In this video, we will talk about how you may be able to incorporate water into your labor and birth experience for pain relief. Did you know studies have shown that water immersion lowers pain scores and reduces the use of medications for pain relief during labor? It's not as effective as pain medications like an epidural, but it has been shown to be an effective pain relief method that you may want to consider using. Immersing yourself in water may be a good option for people who desire or require an alternative to pain medications during their labor. Many birthing people find that taking a shower or a bath during their labor helps reduce anxiety, provide comfort, and also increase their satisfaction in the way that they can freely move their body around and change positions during labor. Being in the water during your labor can help you relax between contractions, and it can also help you cope during those contractions so they don't feel as painful or strong. Some people find that even just the sight and the sound of water can be a calming factor during their labor. Being in water may also shorten your labor. There really are no known risks to you or to your baby if you use water to help you relax during your labor. And research has shown that there is no higher chance of infection for women and babies after labor or birth in water compared to women who do not use water during their labor and birth. So if you and your baby are healthy, you may want to use a tub or a shower, and you can use this at any time and for however long feels good if this is available at your birth setting. If your provider agrees that this is a safe option for you and your baby, they will monitor your baby's heartbeat while you're in the tub, and they'll use a tool called the Doppler. This will allow them to listen to your baby's heartbeat in the water without you having to be connected to any wires or machines. Your provider will make sure that the tub is at the correct temperature because we want to make sure it's not too hot or too cold to affect your baby's health. While you're in the water, your vital signs, such as your blood pressure, your pulse, and your temperature, will be monitored, and your baby's heart rate will closely be monitored as well. This will be done in order to make sure that being in the tub and birthing in the tub is still safe to do so. As we've discussed, a bath or shower can help you relax and help labor feel less painful. Some people even choose to give birth in the tub if this is a safe option for them. Some women feel that giving birth in the water is an easier birth for the mother and a more gentle welcome for the baby. There is a lower chance of having an episiotomy, which is a cut in the opening of the vagina, if you do have a water birth. And when it comes to risks, there is a chance that if your baby is born in the water, that they could breathe water into their lungs. This is very rare. However, to prevent this from happening, your baby will be brought up out of the water as soon as possible. And once your baby's head is out of the water, it is very important that they do not go back underneath the water after taking their first breath. Your provider will gently assist your baby to make sure that they are delivered as safely as possible if you are choosing a water birth. Your provider will go over reasons that a water birth would not be appropriate or may be too risky for you. In order to have a water birth, you will need to sign a consent form, and this will go over all of the risks and confirm that you understand that these risks are involved. This is a summary of using water during your labor experience and potentially if you choose to have a water birth. Make sure you check with your birth setting to see if using water, such as a shower or a tub, is available for you. And as always, please ask your provider if you have any questions at all.